CEO, NorWest Community Health Centers.
Okay, so I understand the safe injection site or harm reduction site has opening today officially. Maybe you can just tell us a little bit about the process of getting here.
So this is a temporary 6-month application that in August we were asked to pause in terms of opening an overdose prevention site. And just recently the minister announced that the province is going to continue support overdose prevention sites and consumption and treatment services. So we were allowed to open. So we were notified just approximately 3 weeks ago that we were permitted to open under our temporary application. So we've proceeded with hiring staff and getting the site ready and did some training and orientation and prepared our community. And so we're ready to open.
How does the site work exactly?
So people will come in, and so it's a place where people can come and consume their own drugs. They can come on site, and they would do so under the supervision of a nurse, a registered nurse, and then have the supports of a harm reduction worker. And part of the premise is to, of course, keep people safe. We know there's a lot of bad drugs out there, and people are using alone or in places where they're not supervised. And unfortunately, we are experiencing a lot of deaths in our region, in our community. And so it's a place for people to come and be under the supervision. And so if there is a potential negative drug reaction or an overdose, that they would be provided with supports to work through that. The other thing, of course, is really ensuring that people have the information and education they need about making other linkages to whether it's mental health and addiction services, whether it's to primary care, housing, and other supports they might need. And then also giving, of course, supplies that they might use, so clean, sterilized equipment.
What sort of staff have you hired for this site?
So we've hired registered nurses, and then we've also hired harm reduction workers. And we're really fortunate that a number of our staff that we have hired have worked at Moss Park in Toronto, and another one of our staff members has worked at Insight in Vancouver. And so they have experience and knowledge and are familiar with how to support clients and how to engage with them. And because that also is an important thing, is creating a safe place to engage with clients who this is not the norm in our community. And so it's creating a safe place for them to come.
How many people are you anticipating, or how many people can the clinic handle on a given day?
So this is a very small scale operation at this point, and we've embedded it within our clinic and are partnering with, of course, with a number of community-based organizations. And but at this point, we only have one nurse, and and a harm reduction worker can handle 2 people who are injecting at the same time, because they always have to be under nursing supervision.
Do you anticipate that there will be a lot of people coming to use the service, and where is it exactly located? Is it here?
Yeah, so we engaged in a community consultation, and we spoke to a number of community partners, to our staff, and then also to a number of individuals, people with lived experience. And part of their feedback was that it was having it embedded within the organization, because we had looked as well as one of our locations on Heron House, a small location there. But we have placed it in the basement. It's and you can access it off Simpson Street near Heron, and use the elevator to go downstairs and use the service. And that's where they would be.
And so how long will this be open? You mentioned 6 months. Is that still the case?
So at this point, there's been lots of changes, of course, with the provincial government and lots of different directions. So we'll have this up and running up until December 31st. And so that might seem really surprising about why we would do that, but we think it's very valuable to offer this service now because there are still people who are in need, and we will be working with the Liko Nishnabek Family Care and with our community partners, and of course with the ministry, to make sure that we can look at an extension past December 31st because there are a number of other applications and processes with ministry directives that we have to complete. And so we're trying to complete those in a very quick period of time.
Do you have to prove that this service is useful or something like that before the end of December 31st when you reapply and when you go through the processes again?
Well, yeah, of course. I mean, the ministry, if they're going to fund things, really want to look at what the needs are in our community. And I think Thunder Bay, unfortunately, has like many communities, but Thunder Bay is really experiencing an epidemic and a crisis with regards to opioid use and deaths, and EMS calls and response, and people going into the emergency department who are in need of emergency services. So there is definitely a need in our community. We do know that in many, like Toronto, there's natural hubs and places, and it'll be interesting to see whether this is a location that people will use. But we have gone through a community consultation process that took place to really take a look at through a community feasibility study, and to take a look at the north and the south side of town. And I think there is needs in both areas of town, but at this point this is the one that we're going to be opening.
Are there specific targets that you're hoping to hit to sort of justify?
No, I don't think at this point we want to say, okay, we have to see 100 people and that's going to make it worth our while. I think, from our perspective, and really a strong message has been, if we save one life, then that's worth our while. So I think it's really hard to know, like anything, like our rapid access addiction medicine clinic, it was all through word of mouth, and that's a program that's really been just taken off amazingly. And I think that's through the value of the partnerships that we have, but also through the staff that are fantastic in terms of their engagement with individuals, and creating an environment where people come where they don't feel stigmatized or discriminated against. And I think that this will be the same. The staff that we have they fit with the values of what we're trying to do here, and I think we'll be really great at creating some place for people to come.
And again, just reiterate how many staff members you have working in the site.
So at any point in time, we'll have one nurse, and we'll have one harm reduction worker, a registered nurse and a harm reduction worker.
But there's more than one that you've hired, so that you
Oh
can
yes,
give them
of
time
course,
off?
yeah. So we of course, because we have to anticipate that people need holidays and are sick, so we have relief staff as well that we've hired. So.